And welcome to the Shatkin First Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin and we're going to be using one of our newest inventions at Shatkin First, the new Enhanced Surgical Guide Stent. This is a 3D printed surgical guide stent. In the past we've used the suck down vacuum form surgical guides, but we've now finally, after a lot of research and programming and software work, we've been able to design our own 3D surgical guides that are printed. And you can see here it's a harder material and it has the pilot holes for the 1.2 millimeter pilot drill. These can be made with 1.2 millimeters, 1.5, 2.0, 2.5, 2.8, 3.0, or whatever diameter pilot holes we need for the specific implants that we're going to be using. In this case, we're going to be placing two mini implants at 2.5 by 11 millimeter length, and we're going to use a 1.2 millimeter pilot hole. We also have had, I'll show you this on the model, where you can see the fit of the stent and the two pilot holes. We've also had a temporary crown made for tooth number 19 on my patient here today. So here's the temporary crown made. You could also very easily have a permanent crown made utilizing the Shatkin First technique, the fabricated implant restoration and surgical technique. But in this case, we're going to put a temporary crown on. So you can see the temporary crown was also made to go in place once the implants go in. Okay, so we're going to be going ahead and doing the procedure here. And this entire procedure shouldn't take more than 10 minutes. It's very simple and straightforward. And this is Philip, our patient here, and he's been kind enough to be a volunteer for this video. And he's already anesthetized. And you can see how nicely the pilot drill, in the past we had to use a pilot drill guide instrument, as you're aware of, and that worked very well for a long time. But as you can see in the pilot drill guide, it's pretty tight fit, but what we were seeing is when we would put that into the surgical guide, there'd be a little bit of give. And this is a much more precision fit because you don't need the pilot drill guide, and this is a hard material. So this is our new enhanced Shatkin First surgical guide stent, and all of the stents from here on out will be designed this way, and I think you're going to like them better. So we use the other ones for over 25 years, so it's time to upgrade and update our surgical guide. So here it is, and it fits really nicely. And we're going to go ahead and get our pilot drill. So this is the Shatkin First programmed aseptico motor with water irrigation. And we're going to go ahead and make our pilot holes. So hold the stent down. Okay. And it's always good to see the bone on the drill. That implies you've got good bone. And you can see the bone on the end of the drill. Okay? Okay, go ahead and give me the implants. And here's how it was designed on the Blue Sky Bio report. 2511. Okay, so we're going to take the stent out. We no longer put the implant in through the stent, but we have a very precise pilot hole. And that should guide us exactly where we want the implant. And we've got 30 Newton centimeters of torque, so that's excellent. And we're going to go up to 60 just for the last couple turns. Okay. That implant is in place. Can you see that? Get in close and show the implant in place. Okay, and we'll take the other 2.511 implant. And we're going to go ahead and put that back to setting number 2, 30 Newton centimeters, and we'll go right in that same spot where we made our pilot hole. And it beeped at 30 already. So now we're up to 60. It's already beeping at 60. Very, very dense bone and very good bone. So look how nice and parallel those two implants are. I don't know if we can see here, but let me get the mirror to retract a little bit. There. Okay, very nice. So now we're going to go ahead and try our crown on. And this is quite large inside. This is just a temporary, so we're going to just fit that over there. And bite gently together. Okay, that's perfect. All right, so what I'm going to do is just use a little bit of temporary cement. This is a product I really like. It's not a product of Shatkin First, but it's made by Ivoclar here in Buffalo. It's called Teleolink. It's a very nice product for temporary cement. It's easy to take off when you need to get it off. So we're just going to fill that up with a little bit of temporary cement. And we'll cement that crown in place. Close together. Close together and hold it. Is that light curable? Mm-hmm. Okay, you can cure it with a light. Okay, just keep biting here, Philip, okay? Your procedure's all done. We're just putting your temporary in now. Mm-hmm. Doesn't get any easier than that. So I'm very excited about these new surgical guide stents. I've been working with Valdemar Blazak, our lab director, for some time to design these for the mini implants. You've seen things like this for larger implants, but we now have the right size sleeves for the 1.2, the 1.5, 2.0, 2.5, and so on and so forth. And these are really nice precision fitting surgical guide stents. So you're going to start seeing these coming to you on a regular basis now. So look out for them, and you'll be very happy with the new design of our surgical guides. Keep biting. Let's see, open. Okay. I'm just going to smooth out this one little edge here. I'm just going to round out the corner of the temporary a little bit. It's a little bit sharper. All right, let's see. And you can go ahead and floss that. I think it's all good. Thank you for being a great patient, Philip. We're all done. And thank you all for joining us on the Monday Morning Minute. I look forward to seeing you next time on the Monday Morning Minute or in person next weekend. Thank you very much. I'm Dr. Todd Shatkin.
We're having our International Academy of Mini Dental Implants meeting this August on the 1st and 2nd down at the beautiful Four Seasons Resort in Orlando. We also are getting the journal together, and Mark's done a great job in years past, so we're looking for case studies. So send in your case studies. Dr. Donald Broccoli is our editor, so he'll take a look at them, but send them in to Mark. And what we're going to do is you'll be able to, not only will you be able to become a diplomat in the academy, but sharing your information and having the case studies. In years past, we've had so many great case studies come in. So think about writing a case study and sending it in to Mark, and we'd love to publish it. So you'll be a published doctor in the International Academy of Mini Dental Implants. And it's a great place to be, and it's a great place to learn. The deadline is July 1st for that. So if you could send them in ASAP, that would be wonderful. Thank you so much.